distribute it then to anybody who attended or registered. So I'll send you the recording. And again, it's Ed Crow. We're going to go over Medicare Supplements today, so I think I'll get us started. So we're going to talk about Medicare Supplements, briefly talk about Medicare A and B. I'm not sure what level. I see a fair amount of people on here who are already doing Medicare, so that'll be a bit redundant for you. I apologize. We'll talk about different supplement plans and benefits. We won't spend a lot of time on an A and B for that matter, but we'll talk about different supplement plans and benefits, and then just some rules and strategies. We'll go through this in about 15 minutes. It should be relatively quick. The idea is just to give you an overview, make you a little more familiar with maybe some of those other supplements you don't sell currently. Okay, so all right, let me just get it started here. Sorry, having trouble with my slide. Okay, so supplement review, here we go. Finally got on the right page. So talk about Medicare A and B. So just a couple brief things to make sure we're on the same page. Supplements cover cost share for Medicare approved services. I get that a fair amount where people think if Medicare doesn't approve it, that the supplement will pick it up. Usually clients think that, but once in a while a broker. Just so you're aware, if Medicare doesn't approve the service, the supplement's not going to cover it either. So Medicare A and B's got to approve it. And a good example of that is when a client gets a cataract surgery and they get the new lens that isn't approved by Medicare. The supplement's not going to cover that lens because Medicare doesn't approve that lens. But any procedure, and they happen sometimes with annual physicals too. With Medicare, obviously, when you're Medicare primary, it's an annual wellness visit. And if there's services that the doctor or provider does that Medicare doesn't approve of, the supplement won't cover it either. So it's important when you're selling supplements just to know your A and B benefits and know how, what your supplement is covering. I do get sometimes situations where people don't know A and B well. And if you don't know A and B well, it's really kind of difficult to sell a supplement then because you're trying to sell a plan to cover benefits that you're not sure, what the exposure is for your client. So I'm sure most of you on this call know your A and B benefits well. If you don't, just, kind of freshen up on them. In general, and I round off when I talk to clients too, so I'll say like 1,400 instead of 1,364. But in general, 1,364 deductible, that's per 60-day benefit period on Medicare Part A. After that, after 60 days, I don't know about you guys, but I've never had it happen. But after 60 days, they take on a $341 a day cost share. Again, I've never had it happen before. This is not a universal bill on Part A, so there are some Part B costs that can be billed when somebody's in the hospital. It doesn't all fall under the hospital deductible. And again, that deductible resets every 60-day benefit period. Medicare Part B, obviously the Part B, there's a cost for Part B. That premium is $135.50 a month. Be aware that premium goes up. You have IRMA. So for higher earners, over $85,000 on an individual, over $170,000 on a couple, suddenly Part B jumps to $189.60. If they're over $500,000 for an individual or $750,000 for a couple, it tops out at $460.50. So, those who make income, and this is 2 years back, by the way, they're looking at 2 years behind. So somebody in 2019, they're looking at what they made in 2017, and they readjust it every year, by the way. But those people can pay a lot more for Part B. They pay more for Part D as well. Sometimes people forget that. I know this really doesn't have to do with our supplement conversation, but if they're paying an IRMA for Part B, they're going to have a Part D, as in David, IRMA, as well on the drug plan. Just keep that in mind. The Part B annual deductible is $185. Then there's a 20% cost share, so obviously $80.20 on Part B after the $185 deductible. Remember that the 20% cost share is Medicare allowable. It's only what Medicare allows, so that's not near as much as your client might think. They might think 20% sounds like a big number, but it's really not that big of a number when you're talking about Medicare allowable amounts. To throw an example at that, MRI, and obviously this depends on where you're located, but in the Northeast, for example, an MRI will be billed at $2,200 to $2,400. Medicare will allow between $400 and $450 of that. Client's going to pay 20% of what's allowed, so not a lot of money. Primary doctor visit, they allow between $65 and $75, and a specialist between about $90 and $100. That's all that's allowed. So that's all they're going to pay 20% of. So just keep it in mind when you're selling a supplement that has cost share. Maybe a supplement with some cost share isn't such a bad thing because the exposure isn't quite what you might think, or what they think for that matter. So we'll talk about common plans. Common supplements, obviously Plan F. So Plan F provides 100% coverage. Again, 100% of what Medicare approves is covered by Plan F. Plan F is not going to be available to new Medicare beneficiaries starting on 1/1/20. Existing people can stay in it. If it's still available for sale, anybody who got on Medicare Part B prior to 1/1/20, they could still purchase it, believe it or not. So when they say 1/1/20, if there are companies with it still on the books, anybody who got Medicare Part B prior to 1/1/20 is still eligible to buy it. Anybody in it can stay in it. But the idea is, as of 1/1/20, there aren't going to be any plans that cover the Part B deductible. That's the whole theme here. And again, it's still going to be available to those already on Part B prior to 1/1/20, if the companies have any available. Those in Plan F can keep it. Plan C will follow the exact same rules. In high deductible F, this is newer information. I was told for a while that high F would still be available, but it won't be. I mean, high F does not cover the Part B deductible. You'd think it'd still be there, but because it's an F plan, I guess they're taking it off the books. So anybody in a high F can stay in it, but anybody who buys into Medicare or enrolls in Medicare, I should say, Part B, as of 1/1/20 or later, they won't be able to get a high deductible F plan. So Plan G, which is really the more popular plan now, that sells often more than F really at this point, depending on price points in your state. But Plan G is the same exact plan as F. It just simply doesn't cover the 185 Part B deductible. One quick thing about that too. Sometimes I'll have people say, well, I don't want to move my client in July from Plan F to G because I'll have the 185. It's already been met. If they've received any medical services, Plan F's already paid that 185 deductible. It doesn't reoccur. It's once a year, but if it's already been paid by Plan F or another Plan G, if they've already incurred it on a Plan G, or if they were on a Medicare Advantage plan, that 185 has been met. Moving them to a Plan G or N is not going to make them incur a new 185 deductible. So the progression, it's easy. Plan F 100%, Plan G everything but the 185 deductible. The Plan N covers all but three things. Plan N covers all but the Part B deductible of 185, just like G. A doctor, whether it be a primary or specialist, can bill, and it's not at the counter, it's after the fact, can bill up to $20, capped at 20 for visits only. So for primary or specialist visit, they can bill $20 to the person, up to 20 for that matter, but they don't ask for the counter. Medicare runs through Medicare sends it to the plan, and then it can be up to $20. There's $50 for emergency room as well. $50 copay. That is waived if they're admitted to the hospital. And briefly on the doctor visit thing, sometimes people think that if they get physical therapy, they'll pay $20. They don't. It's only for a primary or specialist visit. Companies are going to start offering a high deductible G plan in 2020 once high F goes away. I imagine it will be priced about the same. It probably should have the same deductible, I would think, too, probably about $2,300. And the price point should be pretty reasonable, I would guess. Okay, Plan L. We don't see Plan L as much, and there's a couple reasons for that. But Plan L covers 75% of what Medicare doesn't cover. So if you think about it, it's kind of funny, but think about how much that actually leaves them paying. So if it's covering 75% of the Part B coinsurance, it's covering 15% of the B coinsurance, leaving them paying 5%. So an example is an MRI. Medicare allows $400, let's say. 20% of that's $80, but Plan L covers 75% of that. So leaves them paying 5% of the MRI cost, or $20. Same rules apply to the hospital deductible. So if they got a deductible of $1,364, Plan L is going to cover 75% of that. The plan has a $2,780 out-of-pocket maximum for medical. That's the most your client can pay, and then they're covered in full. So again, it would depend on your price point for Plan L in your state or your area. But it can be a very good plan, and the out-of-pocket does not add up very quickly on a Plan L when you're only paying 5% of the Medicare cost share. Really, the only way it adds up a little bit is multiple hospital stays can do it, I guess. But that's usually about it. Plan K is very similar to L, just instead of 75%, it's covering 50%. So same example on the MRI, but we really probably don't even need that example. On a Plan K, you're going to have Medicare, Part B coinsurance, for example, is 80/20. Plan K is going to cover half that. It'll leave your client paying 10% of what Medicare allows. In one of my bullets here, I said Plan L covers 50%. It's a typo. It's Plan K. But Plan K covers 50% of what's left over, so leaves them paying 10%. Same thing with the hospital deductible. It's going to cover half of that. So that's really the weakness on Plan K is multiple hospital stays outside of the 60-day reoccurrence. They're going to get multiple deductibles, and they're paying half of that, so that could add up. You may want to, it's up to you, but if the client has a cash flow problem with that, you might want to toss a hospital indemnity plan in there, like a GTL or somebody such as that, to just help with that piece of it. If cash flow doesn't matter to them and they can easily handle a 55, 60 out-of-pocket max, then Plan K can make a lot of sense because it's upfront coverage, so to speak, because you get Medicare A and B benefits, and the cost share, it doesn't add up that quickly. High deductible F, as we said, it's going away 1/1/20, but it'll be replaced by the high deductible G, which is going to look almost the same. So plan high deductible F is, I think, misunderstood sometimes. People think it's a true $2,300 deductible. It isn't. Medicare is still going to pay their cost share. So Medicare pays their portion. So your client's going to pay their $185 deductible. They're going to then be 80/20 coverage on Part B. If they go to the hospital, they pay the deductible, $1,384, $48 deductible. All they're paying is what's left over. Your client's not paying the first $2,300 of cost. It's just the cost share that A and B doesn't cover. So it's not a straight $2,300 deductible. As a result, people rarely hit the deductible, even on a high deductible F plan, believe it or not, because you're getting the A and B benefits up front. High deductible F can be a great plan for that reason. And it's going to be replaced by high deductible G. Carriers are already talking about it for 1/1/20. But high F can be a great plan to offer. People rarely hit the $2,300, and the premium's very low, and their out-of-pocket max is only $2,300, so it can be a really good offering. A couple things just to keep in mind that I catch myself forgetting from time to time is that you can only sell plans A, B, and C, supplements A, B, and C, to people under the age of 65. I've had many occurrences where I've met with somebody. They look like they're 65. I don't even ask. They're on Medicare A and B. Okay, I'm going to sell them a high F or a Plan G, and I take the app and don't even think about the date of birth, and lo and behold, they're 64 or 63. Well, you can't sell those to them, only A, B, or C. And also make a note that you're very little to no commission on supplement sales to people under the age of 65. Not that that'll stop you from doing it, just that so you're aware. Certifications are not required for supplement sales with most companies. The only exception to that is United Healthcare. But just about every other supplement out there, you don't have to do a cert. You just tell us you want a contract, you contract, you're ready to go. Obviously, with plans L, K, and high F, there's a comp issue. The premiums are not very high on those plans. As a result, the compensation isn't very high. The other thing is the lack of understanding. A client might not understand the high F and the tremendous value of it. It can be an education problem. They don't realize how low the cost share is because of what Medicare allows, a very low amount. And again, the compensation is low because of the low premiums. So those are a couple things working against L, K, and F. We do for plan high deductible F, and we'll have the same thing for G. We have a really unique compensation program for high deductible F. If you think about a high deductible F that's at $50 a month or $38, whatever it may be, our comp's set up so it pays a commission of $207 for a high F sale in the first 4 months. It's really unique. It's a great compensation schedule. It's available everywhere except for New York. Sorry, we're always picking on New York, but that unique schedule still pays renewals, still pays lifetime commissions. It's just it front loads that comp up front in the first 4 months. if you in most states, just about every state with like a United American, for example, the math on high F works really well, especially in states with high or expensive Plan G and F rates, New York, Connecticut, New Jersey, and many others, of course. But if those states have high regular Plan G or Plan F rates, the high F or the high deductible G plan can work really well because of the premium difference. Quick Medicaid thing, you can't sell someone a supplement if they have Medicaid. So I don't want them to be misunderstood. Medicaid means Medicaid. If somebody's getting drug help like MSP, maybe they're an ALMB, a QIMB, SLIMB, you can still say no to the Medicaid question on the Medicare supplement application. The Medicaid question is meant for people that are getting Medicaid. So if they're especially an ALMB or SLIMB, drug help only, you check no to that question. Because if you check yes to Medicaid on your application, even if they don't have Medicaid, the application is going to get denied most likely. So people with drug help programs can still enroll in a Medicare supplement. And they still may have a reason to do so. Even if I've seen many QIMBs that really have a reason to do so. A couple other things, just reminders, supplements never have networks. I hear that all the time from some reps, but from a lot of clients and prospects. I don't want Blue Cross's supplement because I've been told the doctor's office doesn't take it. Well, they do. When you have a supplement, Medicare is primary. It all comes down to Medicare. Do they participate in Medicare or not? If they're an opt-out of Medicare, nothing's going to help them anyway. And there's going to be a sign in their office that says we opt out of Medicare. But if they take Medicare, which right now that's every hospital in the United States with the exception of certain children's hospitals, still it's 98% of doctors, still, believe it or not. You can use any supplement you want. You could use Ed Crow's supplement. They only care about Medicare, and they're going to bill Medicare as the primary. The Part B deductible, I mentioned this before, but that's only billed one time per year. It doesn't carry over. So if you move somebody from an F or a G or a Plan N in August and they've been receiving medical care and you put them in a different Plan G or N, you're not giving them a new deductible. They've already paid it. Plans C, F, high F, G, high G, and N have foreign travel benefits. Just don't forget that. It's easy to forget. Sometimes I'll show somebody a Plan L or Plan K, forgetting to mention the foreign travel benefit part of it, obviously, because those are the plans that have travel benefits and the others don't. Those who ask what is the travel benefit on those plans, it's $250 deductible. Then it's covered at 80/20. The plan covers 80, they pay 20, up to a $50,000 benefit max on AARP, for example. That benefit max, some carriers can have actually expanded benefits beyond that. I don't think any do. But a $250 deductible, 80/20, up to a $50,000 benefit on the foreign travel. More other things. You can cold call Medicare supplements. People confuse the CMS guidelines a lot. CMS regulates Advantage and Part D plans. They don't regulate supplements. So you certainly can cold call us up. You can use a power dialer, auto dialer, lists. You can email them. You can email Advantage and Part Ds now too. But you can cold call them. Obviously, you want to be DNC compliant with your list. We can run lists for free for everybody. We never charge anything for those. But regardless, CMS guidelines don't apply to supplements. Use the guaranteed issue rules in Massachusetts, Connecticut, and New York. That'll help your prospect and help you too, meaning you can switch anybody the first of any month. If they're in a Plan N that's overpriced, move them to a Plan N that's well priced. If they're in a Plan F, but the G makes more sense mathematically, which, for example, in our state it does. Our Plan F, cheapest Plan F is $248. Cheapest Plan G is $190. The only difference is the $185 deductible. It's a no-brainer. In the guaranteed issue states, you can move them the first of any month all year, and it can never be underwritten. Makes it easy, really easy. ARP and Anthem in states that are Anthem, Blue Cross Blue Shield. AARP and Anthem states, they pay commissions for 6 years. This is changing or has changed in many states where they go to lifetime. If you notice, though, they still do usually have a reduction after the 6th year, but at least they're going to lifetime commissions. United American pays commissions on high deductible F and all their supplements, for that matter, for life. No certification required, and they pay it for life. A couple other things. You can write a supplement the first of any month, as we mentioned. Most states, of course, have underwriting outside of guaranteed issue periods, meaning if you're outside of your initial election period, the 6 months where you get Part B. Or if you lost work coverage, that's a guaranteed issue period. For signing up for Part B, coming off work coverage. Other than that, though, in most states you can be underwritten. There are a few states that have birthday rules. I think California and Maine, maybe. But if there's a birthday rule, that gives them a guaranteed issue period. But other than that, in a lot of places, you'll have underwriting. Use a power dialer if you're going to cold call. Don't sit with lists. If you're going to call, don't use a ruler going through a list. Get a power dialer. We can give you access to one for a good price if you want. It's not ours. It's another company's, but we have a discount. And the power dialer will just simply speed up, all electronic, and it just calls one number right after the next, and you don't have to use a ruler and dial your phone. Find a lower cost plan or move somebody to a lower cost supplement if you can. You can, especially in a guaranteed issue state, if they're in plan F, go to G or N. If they're in G, you can go to N. You can go to L, K, or high F. Show them some alternatives. Show them some options. A lot of times on a supplement, they have more than they need. They really do, especially in a guaranteed issue state. You don't have to worry about it. In a non-guaranteed issue state, if you move them within the same company, most companies, that can't be underwritten within the same company. However, be aware, if you weren't the original agent of record and you move them within a supplement, you're not going to get paid on it usually either. So, again, just for your knowledge. That's it. Short and sweet. Just want to get to the point on everything. Again, if you have other questions, I did record this, so I can send it out. Will send it out. I'll send the slides out as well. If at any time you have any questions, just call our office. You see the number there, 203-796-5403, or you can email me, edward@cronassociates.com. Supplements are easy. And one last thing I'll just mention, a strategy for those who want to get into Medicare, but they don't want to take AHIP, AHIP, and they don't want to take a million certs. One idea is, if you're in a state that supports this, because if United's competitive in your state, you can get set up with United Healthcare to offer their Advantage, their Part D, and their AARP supplements by just doing United Cert online. United is the only carrier, one of the only ones I know, that doesn't require AHIP to write their Advantage and Part D. So you can do a United contract, and then you can do supplement contracts with all the other companies you want supplements for, because the supplements don't require certs. So that gives you an Advantage plan, Part D plans, ARP supplements, plus all the other company supplements you want. And you only have to do one certification with United Online, and you don't have to take AHIP. So it can be a good strategy to get people started. I try that a lot with them just to get them going, and then whenever they want to add any additional carriers, Advantage plans, Part D, whatever it may be, they just call us and let us know. Other than that, that's it for today. Appreciate you coming on. Again, I'll send this out to everybody. Thanks for your time, and if you have any questions, give us a call. Thank you.